my thinking on this Parkinson's disease biomarker program has been from this idea that we just find biomarkers to a real world desire to basically help clinical trials be better, more efficient, more likely to lead to kind of, a disease-modifying therapy. Okay, so I think if you decide that that's your goal, to try to help clinical trials that are primarily for agents for disease-modifying therapy, that clarifies a lot of what you're trying to do. So what you're trying to do is you're trying to find markers that are objective. So all of the measures we use in the clinic are not so objective. They're dependent on how someone interprets, how frequently someone can tap or something like that. And we know that these things vary across time. And we also know that they don't necessarily tell us about the biology behind something. So I'm hoping, with my project in the PDBP, to find markers that may root you to some biology, right? And in addition, because they may help us be sure we're dealing with people with Parkinson's disease versus not, and also predict how a given patient's going to do over a time course that's relevant for a trial, which is only 2 years usually, right? That may help us have more efficient trials. So that's really the goal. Mine is actually relatively easy. I have from the outset been trying to see if we could develop a set of markers, not 100, a small set, the number that could actually conceivably be in a clinical context, right? A small panel of markers from the blood, right? So that's just a blood draw like you get at the doctor's, right? That initially the goal is just to see, can you tell if this person has Parkinson's disease or not, which I think is probably kind of reassuring and helpful in a clinical context, just to have some sense of diagnostic confirmation, However, the other thing I've been thinking about more recently, because I've been thinking about how to make disease-modifying therapy, because, if you are confirming that you have Parkinson's disease, the next question is, what do we do about that, right? So the thing I've been thinking about more recently is how at the same time that we find a panel of proteins that we measure from the blood that might tell us who has Parkinson's disease versus not, can we also find a small panel that tells you who's going to progress quickly versus slowly? And that's important for patients and families because they may want to know, am I going to progress quickly or slowly? But it's also important from the perspective of planning a trial. Because if you have a bunch of people who are progressing really quickly and you have a bunch of people who aren't progressing at all, and you have them in the same trial, and you're trying to see if your medication or your treatment helps them, these people who aren't progressing at all, they can never add to your signal. Right? So I think that kind of markers of progression as well as markers that classify diagnosis are what we're trying to develop from blood-based proteins. I think there's 2 avenues that I'm really excited about. One thing is the new project I have in the PDBP is actually a replication of my previous project. So my previous project was to find a panel of markers, and we found that, right? And so this new project is to see, okay, are those markers only valid in Philadelphia, right? Or are they going to be valid in a national set and then eventually in an international set of samples? And I think if, within the scope of this project, we find that we can get replicated signal, I want that to become a test, like a test that a doctor can order, a test that, a clinical trial can use to enroll patients. And I think that may mean partnering, right, with somebody who knows how to kind of put that into the clinic. That's basically commercialization, which isn't something I ever thought about before. But as you get closer and closer to seeing something that might actually make a difference, you start to think about those steps, so that's one pathway. The other thing that I'm really interested in is, so my projects have always started with large-scale unbiased screens of very many proteins all at one time, so 1,000 proteins. And the thing that can happen if you're looking at 1,000 things is you might find a pathway that you never knew was involved in the disease of interest. We're seeing some of that right now, you know. And so if you see a signal from a pathway that was previously not suspected to be in Parkinson's disease, the other place I'm taking my research, not with the PDBP, but just my research in general, is to take some of those leads and see if we can develop those pathways as new therapeutic targets, right? So, you know, if we find that multiple aspects of, I'll say one thing that's showing up right now is kind of things related to melanin, right? You know, if we find that multiple hits related to the melanin pathway are interesting, right? How do we start to test that to see if an outcome and a measure are just correlated, or if manipulating one causes something else to get better? That's a causal relationship. So we'll see.